Come learn about Flatback Syndrome. One diagnosis when it comes to spinal position, and especially in adult spinal position, is something called adult spinal deformity, is something called Flatback Syndrome. We know the spine is supposed to have natural curvatures, and these natural curvatures of the spine will make the spine strong and more flexible. These natural curvatures from the side view of the spine also allow the spine to better absorb and distribute mechanical stresses throughout the body, and it facilitates optimal spinal health and function. The spine needs normal curvatures. The spine is not supposed to be straight from the side. It's supposed to have normal curves. So there's normal curves within the spine, and there's something called a kyphosis. A kyphosis is where the spine bends towards the back side of the body, and then there's something called a lordosis, which bends to the front side of the body. And we know these curvatures act within specific areas, meaning that you should have a lordosis in the cervical spine and in the lumbar spine, and you should have a kyphosis in the thoracic spine. And these sections or these areas of the spine are normally associated with these types of curvatures. There is a healthy range for kyphoses and lordoses. However, if curves fall outside of this range, meaning they're too small or too large, they can affect the entire spinal biomechanics. And they're all relative to each other, meaning that when you affect one area, you can affect another and vice versa. So therefore, we know these normal ranges are very important. When we look at a cervical lordosis, the most accepted ranges is between 20 and 40 degrees. When we look at a lumbar lordosis, meaning the low back, we know it's between 40 and 60 degrees. And the thoracic kyphosis area, we're thinking it's between 20 and 40 degrees. So if we look at these normal curvatures, what happens when a patient actually loses or is outside this normal range? Well, one diagnosis is something called Flatback Syndrome. This is when its spine loses its normal or natural lordosis, kyphosis, or both, and the spine becomes abnormally straight from the side. In the adult form, this can also be diagnosed as adult spinal deformity, where the spine is actually no longer in its normal sagittal alignment. Global sagittal alignment is very important as patients age and as they get older to maintain proper mobility and gait and structural stability with gravity over time. And the most common feeling is that it causes a forward pitch posture. It makes patients feel like they're kind of falling forward. And this forward pitch posture can lead to the excess muscles within the back and spine to get excessive tight, and they get fatigued because they're constantly contracted. It can lead to mobility issues, can start affecting the way people walk, and most problematic, it can actually affect patients from standing up straight, and it can lead to their head and their body going more forward. Now, this becomes an issue as patients age, because as patients age and they can no longer stand and walk, that can lead to affected mortality. It can affect their ability or their lifespan. So keeping patients up and moving is very, very, very important. So maintaining or treating flatback syndrome, especially as patients age, is something that's considered a priority, because we want patients to be able to stand and move and walk for as long as possible. The big thing when it comes to treating flatback syndrome, or patients have lost these normal curves, is that you have to have a treatment plan that addresses the cause. And the cause is actually the shape and structure of the spine. Many of these patients may get treatment dealing with what their symptoms are, meaning low back pain, muscle pain, symptoms that are associated with the actual structure, but they leave the structure the same. This is almost always leads to an unsuccessful outcome, because they're not actually addressing what's causing the problem. We have to do very specific types of rehabilitations and therapies and treatments to help restore these normal alignments. And this can be done with structural types of chiropractic care. It can be done with very specific therapeutic exercises and physical therapy. It can be done with exercises to help increase core strength and stability. And it can help deal and reverse some of these related muscle imbalances. But if the care isn't structurally based, it's normally not going to resolve the structural condition. And even though they may feel better as a result of some of the treatments they're getting, they're truly not getting structurally better. In addition, not only does the care has to be addressed the structure, it has to be multimodal, meaning you can't just do therapy, you can't just do exercises, you can't just do chiropractic, you can't just do rehab. You have to do all of those things, because all of them are very important. So making sure every component of the therapy or the program is working together is one very important factor. Here at Scoliosis Reduction Center, we combine all those therapies and treatments to be very complementary to each other to provide the very best outcome to help restore normal spinal health curvatures and help restore normal alignment to make the spine as healthy and as strong as possible and prevent further progression of the flatback syndrome, which can lead to more functional concerns, especially as the patient ages. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.